Hey everyone, Dr. Yeager here, and thanks again for tuning in to our weekly podcasts. So, you're out walking your dog one day, and being a responsible dog owner, you lean down to pick up their stool. You stop when you notice white light specks poking out. Some of them may be moving, some of them may not be. Well, either way, you know that something is wrong. This same scenario can happen when you're scooping your cat's litter box. You are probably very grossed out, and your pet probably has intestinal worms. But don't worry, intestinal parasites can be treated pretty easily. After examining your pet's stool sample, your veterinarian informs you that your pet has tapeworms and then prescribes the right medication to get rid of those nasty parasites. But not all intestinal parasites are able to be seen by the naked eye, though. This is why, once a year, your primary care veterinarian will usually request that you bring in one of their stool samples to run for testing. Today, I'll be giving a brief overview of some common intestinal parasites that can impact your four-legged friend, whether they be of the feline or the canine variety. The most common intestinal parasites are tapeworms, roundworms, hookworms, and the protozoa called coccidia and giardia. Most pets will be affected by intestinal parasites at least once in their lives. Many of these parasites are not able to be seen by the naked eye, and the more time your pet spends outside or around other animals, the more likely they are to get them. It is important to know that tapeworms, roundworms, hookworms, and giardia are considered zoonotic. This means that these parasites can be transmitted to us humans. Let's begin with the most common of the intestinal parasites, roundworms. The majority of cats and dogs will harbor these worms at least once in their lifetime. Often puppies and kittens have had the worms passed on to them from their mother during pregnancy. Our pets can also get these worms by ingesting them. At the adult stage, these parasites live inside of the host's intestines. For infected puppies and kittens, they will often have a distinct pot-bellied appearance. The worms may or may not be visible in your pet's vomit or stool. If they are, they have a white, sometimes brownish color to them, and they can be several inches long. Tapeworms, perhaps, are the second most common of the intestinal worms. They are flat, segmented worms that transmitted when a dog or cat comes into contact with an infected host. Tapeworms can be transmitted when your pet consumes them, whether they are ingesting infected stool, scavenging, or catching prey. The most common way your pet can get tapeworms is by ingesting a flea. Yes, a flea. Often this occurs while grooming. It is crucial to keep your dog or cat on a great flea and tick prevention, especially if they are going outside on a regular basis. Tapeworms, like roundworms, will live in the intestines once they have grown. The segmented worms will often appear in your host's stool, like your dog, or can sometimes be seen crawling around the anus. Yuck. A lot of times you can also find them where your pet likes to sleep. Yuck. The segments are usually pale and white and look like a dry grain of rice. The next intestinal worm to discuss are whipworms. They can also affect both our feline and canine companions, although whipworm cases are not very common for cats. These parasites can be transmitted by a pet eating contaminated matter such as feces, water, and even soil. Whipworms can live for months to years, often making contaminated areas recurrent. Unlike roundworms and tapeworms, whipworms can only be detected when a fecal sample is examined. The last of the intestinal worms can also have the most serious of consequences, hookworms. They not only live in the intestines, they invade them. The most common way for a dog to get these nasty parasites is by walking or playing in contaminated areas. The worms hook onto their paws and penetrate through the skin. Puppies can also get the worms while nursing from an infected mother. These blood-sucking parasites can cause anemia and severe inflammation of the small intestine. Even after they bite, bleeding in that area can continue. Visible symptoms include pale gums, pale ears. Infected dogs tend to look and act like something is just wrong. A lot of times their appetite has decreased, tarry and dark stool. Diarrhea and constipation are also common. If the hookworms have found their way into the dog's lungs, Fluffy may have a little bit of a cough. In untreated cases, hookworms can cause death, though fatal cases occur usually with puppies. These roundworms are not visible to the naked eye. The last two intestinal parasites that we'll be talking about today, Coccidia and Giardia, are both protozoa. Coccidia are single-cell protozoa that can infect dogs as well as cats. Though oftentimes Coccidia affects puppies, it can also affect adult dogs and cats. Transmission occurs when a pet ingests infected feces. This parasite can only be identified through a fecal flotation. Giardia contamination occurs through contaminated feces being consumed. This can happen when the feces runs off into water or onto anything that a pet may choose to ingest. So, if you like to take your four-legged family member on outings like camping or hiking, be sure to filter their water, just like you would. Even the cleanest looking water source can contain Giardia. Generally speaking, your pet can get intestinal parasites from the environment that they are in. Whether in your litter box, in the backyard, or out and about, it's always important to clean up after your pet. For most of the intestinal parasite symptoms can be asymptomatic or also include diarrhea, loss of appetite, bloody or tarry stool, constipation, dehydration, anemia, and a general unthrifty appearance. If any of these symptoms occur in your pet, you should take your pet to your veterinarian's office. So now when your veterinarian asks you to bring in a yearly fecal sample, even when your pet appears healthy, you know why it is so important for your furry family member's health. Parasites are also the reason why puppies and kittens should go through a series of 3 deworming treatments. All of these intestinal parasites can be easily treated, and many can be prevented. There are heartworm preventatives that also treat and prevent intestinal worms. So, if you have a dog who loves to get into stuff he or she shouldn't be getting into, or if you go on a lot of outings with your pet, talk to your veterinarian about the best heartworm and intestinal parasite combination prevention. The same goes for cats. Even some flea and tick preventatives also combat some of the intestinal worms. Remember, many of these parasites can be transmitted to you or your family. From all of us here at Full Circle Animal Healthcare, we hope you and your fur kids have a wonderful, safe, and parasite-free week.